Good evening. My name is Rachel Osei. Currently, I'm an OBGYN physician here in Denton, Texas at Caring for Women. I specialize in preventative care, prenatal care, detection of sexual transmitted disease, PAP test screening, and family planning. But I subspecialize in reproductive endocrinology and infertility. I have been practicing for 16 years now, and I love what I do for a living. Endometriosis is a painful disorder in which the tissue that normally lines the uterus grows outside the uterus. It is common, and more than 10 million women in the United States are known to have endometriosis. Endometriosis can be found in up to 50% of infertile women. The main symptoms of endometriosis is pelvic pain, mainly associated with the menstrual period. The menstrual pain is far worse than usual, and the pain tends to increase over time. Other symptoms include pain with intercourse, pain with bowel movements or urination, most likely during the menstrual period, excessive bleeding, and infertility. Often, I recommend exercising regularly and reducing alcohol consumption to help treat endometriosis. Hormone therapy, such as birth control, is helpful as well. But dealing with infertility, I recommend surgery to remove as much as endometriosis as possible to preserve the uterus and ovaries. This procedure is called a laparoscopy. This past week, I had an appointment with a patient whose name I will not disclose due to privacy policy. The patient and her husband have been having a hard time trying to conceive a child. After completing a thorough pelvic exam along with the ultrasound, I saw the patient had cysts, accompanied with scarring along her uterus. I completed a laparoscopy on the patient and found endodermal tissue outside of the uterus. I diagnosed the patient with endometriosis. The patient was a Hispanic 29-year-old lady. She had a family history of endometriosis. There is nothing to do to help prevent endometriosis, but long-term use of birth control hormones may help prevent endometriosis from becoming worse. Also, knowing the risk factors is important. Risk factors tend to include if you started your period at an early age, having a high level of estrogen in your body, short menstrual cycles, and a family history of endometriosis. Endometriosis can be a challenging condition to manage, but early detection is important.